So, Dr. Mike, I understand you have some advanced knowledge about some of the emerging technologies and things that really do help people extend life, things that very few doctors, specialists, chiropractors on the planet actually study because it's relatively new. It's been studied for a long time, but now it's really emerging as the path to really make people healthy. Can you give us a little more in-depth explanation here? And I know you've got some information on the wall that'll help us to understand.
Well, thanks, Carter. But this stuff really isn't new. We're studying it a lot more now, but it's the study of genetics basically. And in our genetics, there are basically pathways that everything takes place. If you look up at this chart over here, these are just a few of the pathways. We know about 11,000 different pathways. So when we eat food or we ingest air, take in air, something comes into contact with our skin and we absorb that through our skin. To break these things down and to utilize them, we use these pathways, and some create energy, others create waste products. There's just numerous things that everything is being done chemically in our body. Well, through the study of these pathways, we know what kind of effects our body has and outline symptoms that occur. Let me give you an example. Let's say somebody has depression or a child has ADHD. Any of these cognitive disorders, a lot of times the traditional medicine would like to use a group of medicine called SSRIs, which is selective serotonin reuptake inhibitors. The reason they like to use this is because serotonin and dopamine need to be on an even level. If you drop the serotonin, the dopamine automatically goes up. It shows on this pathway right here, serotonin and dopamine right here. So by lowering or inhibiting serotonin, which also causes a lot of other side effects, it will raise dopamine levels, which will help with depression. But there's another way we can go about this. We can actually enhance things in these pathways that will make a difference in people's lives naturally without using drugs, without any side effects. Let me give you another example. So if we use something besides serotonin, if we go over here to this chart, so we have a problem with serotonin. So I just look at the chart and we have a problem with serotonin. I go to MAO, the MAO pathway. So then again, we go over here to the MAO pathway and we see serotonin is the challenge. Well, the remedy is P5P, pyridoxal 5-phosphate. Pyridoxal 5-phosphate is a natural form of vitamin B6. Okay, so then we go and we test vitamin B6 on this patient and see if it works or not. And if it does work, which most of the time it does, then they have to take a natural form of vitamin B6 for a period of time and we'll see if that makes a difference. If not, we go back to the chart and we test something else. So there are definitely natural ways to get better, to normalize things in the body without taking inhibiting and blocking factors in the medications we use today. Thanks for your question, Carter.
So, Mike, is it fair to say that your challenge, something you really appreciate, that you like to help people with, is to understand how to treat the actual problem rather than treating the symptom?
That's right, Carter. We don't look at symptoms here. In fact, we're trying to get away from symptoms, symptom care, and causing further symptoms. So yes, this truly gets down to the cause of people's problems. This is basically genetics.
Well, that's what's going to help people live a long, healthy life. Appreciate it, Mike. Thank you. Dr. Mike.